I'm really thrilled to be here, and I really want to thank Maria and leaders of Jobs for the Future for inviting me to participate on this panel with Ai-jen Poo and Liz Shuler. And we're excited to be able to share our thoughts on what is needed for an economic recovery. The past 14 weeks have been a real shock to our system. I, like many of you, have been reading newspaper articles and briefings painting the picture of just how vulnerable too many people, families, businesses, and communities are in the face of this pandemic. It was sobering to see the front page of the New York Times on May 24th, acknowledging that we as a nation had reached 100,000 deaths, listing the many people who have lost their lives to this virus. And as of this morning, projections are that we will lose another 100,000 people to the coronavirus by this fall. We've had too many workers on the front lines of this pandemic without proper protective equipment, contributing to the high rates of infection and death, which are totally unacceptable. Workers today are facing three immense crises: the global health pandemic, the economic downturn as a result of this pandemic, and police violence in Black and Brown communities. Millions of people have lost their jobs. And we know that even before this economic recession hit, there were close to 64 million people who earned less than $15 an hour and can barely make ends meet by living paycheck to paycheck. There are people in essential jobs today who still don't have the personal protective equipment they need, the paid sick leave guaranteed so they can self-quarantine, and the testing to know whether or not they have been exposed. This moment has laid bare the results of decades of growing inequality and compounded it, taking a disproportionate toll on the poor, people of color, immigrants, people with disabilities, and others who were already marginalized before the crisis. But this moment of crises is also lined with enormous opportunities. This is a time where we have to choose as a nation if we're going back to the status quo that was not good for the overwhelming majority of working families, or are we going to use this opportunity to create real structural change that we need to rewrite the rules in the environment, jobs, healthcare, immigration, and economic systems to allow everybody to live healthy, safe, and dignified lives today and into the future? As a foundation that is committed to combating inequality, we are committed to supporting partners to build back better and to ensure an equitable economic recovery, one that challenges practices, changes policies, and activates the systemic reforms necessary to address inequality, its root causes, and in all of its forms. The ultimate economic aspiration for our democracy is how it lifts up our people. As Dr. Martin Luther King Jr. said, "Someday our nation will realize that the sanitation worker is as essential as the physician. All labor has dignity." Well, that time is here. Such a recovery must include the creation of good jobs and pathways for more workers to access good jobs. And it must also be rooted in a vision and principles of economic dignity for working people. And that means rights, protections, and voice for workers. We believe that all workers, regardless of whether they're permanent, informal, contracted, or gig jobs, should have equal rights to robust labor protections. You should not have to put your life at risk when working. We as a nation should guarantee social protections for all workers, paid sick days and paid leave. In other words, you have the capacity to not only care for your family, but to be there for life's most meaningful and joyful and even sad moments. That is what caring for family really means and what working people need and deserve. And workers must also be seen as critical stakeholders in our economy and in our businesses. We need to partner with workers to design and shape jobs, policies, and economic models that affect their lives. This can ensure that when we work, we are in fact can contribute with respect. To ensure that we can advance such an equitable economic recovery and that the future of work truly makes all of our lives better, not just the lives of a few, we need everyone at the table working together. We need business, tech, academia, workers, government, and philanthropy working to ensure we build back better and create good jobs and economic pathways that can benefit workers today and for generations to come. If we are really to honor essential workers in this crisis and more in the long term, we need to change our view of what our compact in our country should be. That everyone who contributes and who work, especially if they're putting their lives on the line, should be able to live, work, and age with dignity. With that, I will turn it over to my fellow panelists who will share more texture to this approach to economic recovery. We will next hear from Ai-jen Poo, the Executive Director of the National Domestic Workers Alliance, representing 2.5 million domestic workers across the country. Thank you.
Thanks so much, Sarita. I'm so glad to have the opportunity to talk with you and Liz and everyone who's joined us. The truth is, this is a really difficult time for workers, as everyone knows. Workers like domestic workers have been devastated in the COVID crisis, and it has to do with the fact that their work has never adequately been protected or valued in our economy. The nannies who care for our children, the home care workers who support our elders and our loved ones with disabilities, the cleaners who keep our homes safe, they actually came into this crisis without paid time off, paid sick days, without health care or job security, and earning poverty wages. The average annual income of a home care worker is just over $16,000 per year. So there was no money to stock up on groceries or supplies. And this work, by definition, can't be done remotely, right? So domestic workers were among the first to lose their jobs and income, and it's been a struggle to put food on the table since. Black domestic workers in particular have been disproportionately affected by the COVID crisis on every level, from the virus itself and the deaths that have ensued to the economic fallout and loss of jobs, and the pervasive police violence that is a constant threat in Black communities, all while having disproportionately borne the brunt of caring for our families through crisis after crisis. And many domestic workers continue to work through this crisis as part of our essential workforce. I'm thinking of Priscilla Smith from Fayetteville, North Carolina. She's a dedicated caregiver, a Black mother of 4, and a leader in our We Dream in Black program. Priscilla has been doing direct care work for 7 years and is currently working in a residential facility. And that facility has promised over and over supplies and protective gear, and they still haven't arrived months into this crisis. And she's also caring for her own daughter, who is immunocompromised, and her 1-year-old granddaughter. And this is the reality for so many essential workers throughout our low-wage economy, who are literally keeping us safe and keeping our country together. And I guess I would say the good news here is that the whole country is awakening to just how many workers we have taken for granted and undervalued, and that are actually essential to our very health and safety and well-being. The grocery workers, the delivery workers, the farm workers, janitors, and domestic workers. We basically have a once in many generations opportunity to address the fact that we have undervalued so many working people, and to make low-wage jobs good jobs, and to remake our safety net to actually protect them. In the jobs and workforce world, there's been an obsession or a preoccupation with upskilling the worker. But even if we trained and retrained every worker in our economy, these jobs would still be poverty wage jobs. Many of the jobs available in our economy just don't earn the wages to make ends meet and aren't protected by our safety net. And we have to focus on upgrading the jobs, improving the wages, supporting working families. We should be passing essential worker bills of rights, raising wages, creating universal access to childcare and long-term care. The solutions have actually been clear for a long time. And this is our moment. This is our opportunity to finally, once and for all, address it and to restore the dignity of work in America. This is our time. And with that, I'm really proud to introduce a sister, Liz Shuler, who is a longtime leader in our labor movement and Secretary Treasurer of the 12.5 million member strong American Federation of Labor, representing 55 national unions around the country. Liz, take it away.
Thank you, Ijen, and to Sarita as well. It's such an honor to be on this panel with you, my sheroes, and thank you for your insights and your powerful interventions. Before I speak, I wanted to share a video because I think it's important as we talk about worker voice to really bring their voices into this conversation. So I wanted to bring the voice of a nurse who's working on the front lines of the pandemic into this space. So if we could roll the video.
One touch in the wrong area could be that minute that makes a difference for the rest of your day or the rest of your life. So it's just, we always have that in the back of our mind. Which one are we taking off first? Is it the gloves? Is it a gown? Is it, I'm washing my hands. Am I washing my hands long enough? It's that anxiety of that, it's real. It's real, it's very real. And I've gone to shifts where you have a patient and you have to wear a N95 the majority of your shift. It's nerve-wracking after a couple of hours of wearing an N95. And I remember there was a week that I wore it so many times. After a while, it's like you almost feel like you start to get anxious when you wear it because the way you have to, the breathing pattern. And it's just I had one incident where I came out of the patient room. This patient was a little bit more awake than other patients. I came out of a patient's room. The patient was nervous, and they called me as soon as I left. So I had to put another pair of PPE on right and run back into the patient's room. And my N95 wasn't dried yet. And I put the mask to my face, and all of the Clorox that you use to clean the mask, the fume literally just went off my nostrils, and I could not express what that felt, the burning sensation that I felt off my nose. So we take it one day at a time. Yesterday, I was on a call with NNU, and we had at the end of the call, we were training for something, and at the end, they listed all of the nurses that have died with COVID-19, and we had like a candlelight ceremony for them, and that experience was really hard for me. It felt like they started listing names and it didn't stop. And I know several people on the call got emotional to the process, and they were crying, and appropriately so, because the reality is it could have been any one of us on that call, right?
So Ijen and Sarita talked about what workers are going through and the importance of creating good jobs with a new social contract for working people. And I think what you just heard from Mawada Kamara is a National Nurses United Union member, her feelings of fear and anxiety and the feelings that come with simply going to work. And we are quick to call essential workers like Mawada a healthcare hero. But that is how these heroes are feeling. I want you to let that sink in. And today we're talking about how industry leaders use their influence to create a better future. And what I hope to bring today to this conversation is the influence that workers should have in shaping that future. Mawada and millions of frontline workers are getting us through this national crisis. Millions of others have been left unemployed overnight through no fault of their own. The murders of Ahmaud Arbery, Breonna Taylor, and George Floyd by police have put the pain, anger, and frustration that Black people and communities of color feel front and center in America. Their voices should determine the future of our economy. And if we're going to change the systems of economic inequality and discrimination and the power of the status quo, we need to be honest with ourselves. And Sarita and Ijen said this, the cracks in our economy and in our society, they existed long before 2020. The pandemic and public reckoning over systemic racism in the past few weeks have exposed those cracks even more. And these are the unsafe working conditions, the lack of paid sick days, blatant institutional racism in the workplace. These are the things that are now coming to the surface that everyone sees. And so, as was said earlier, our goal should not be to simply return to normal, right? We have to organize and mobilize and return to better. And how do we do that? Well, I would say collective action, power in numbers, and the labor movement would argue collective bargaining for all working people, because the future of the economy rests on working people's ability to stand together and generate power to really create an economy where everyone can prosper. And unions were meant for this moment. I keep saying this. Unions and collective bargaining rights are really the most effective tool in winning better wages and healthcare and training with real worker voice and protections on the job. And during this pandemic, we've seen people are going to work in unsafe conditions. Why? Because they're afraid to speak up. They're afraid they will be fired, or the economic impact is driving them because they can't, they're living paycheck to paycheck, right? And this is what we heard from a gentleman named Chris Smalls after he planned a walkout over the conditions at a Staten Island Amazon warehouse. Several of his coworkers tested positive for COVID-19. The company refused to provide basic PPE or clean the facility. Amazon fired him for insubordination. And we saw in leaked emails that Amazon's general counsel called him, quote, not smart or articulate. And so here we see corporate retaliation in full force. Now, it's different for union members because we've used our collective power to protect one another and then make those demands for PPE, hazard pay, and safe workplaces. So I would argue now is the time to seize on this momentum to organize. And I wanted to bring an example of Hearthside Food Solutions in Mississippi. They package cereal. Now, if you had Kellogg's for breakfast, this is where your meal came from. Last month, they voted in favor of joining the United Food and Commercial Workers Union. This many of them were promised that their temporary jobs would become full-time jobs, and they watched as management got raises during the pandemic, but they did not. So now they have a union, and they can stand up for their rights and their safety without fear. And another example, in true union solidarity, I'm thrilled to tell you that the faculty at Oregon State University just won their first union contract after 6 years of organizing and 18 months of negotiating. This is a big deal for those 2,200 workers. And I'm saying that as an Oregon Duck from University of Oregon. So you know that's the power of a union. But the labor movement has been very proud to stand up and join the collective action we've been seeing in the streets with the protests over the past 2 weeks to fight for economic, social, and racial justice. It's who we are. Many know that our history in the labor movement goes back to, I would argue, in the last key moment in history in 1968 that everyone's comparing 2020 to, right? Where we had two African-American Memphis sanitation workers, Echo Cole and Robert Walker, who were crushed to death in 1968 by a malfunctioning truck. 12 days later, 1,300 Black workers in the Memphis Department of Public Works, with no notice to anyone, went on strike. For 2 months, they marched every day with a simple slogan: I am a man. And their fight brought Dr. Martin Luther King Jr. to Memphis. And Dr. King spoke to the sanitation workers on strike and those who joined them in solidarity. And he told them that he had been to the mountaintop. He had seen the promised land. And he reassured them that when they got there, even if he was not there, that justice would be theirs. And the next day, Dr. King was killed after speaking and marching with those sanitation workers in Memphis, and they won a union at AFSCME. So this is my point. The labor movement is and has always been rooted in the fight for justice, and that is the change that we bring with the collective power of workers standing together. And by joining together, workers can shape an economy that works for everyone. And we need more unions in our workplaces. The contracts that give us the real enforcement power and a say in these policies and practices. And that's what I hope that leaders from today's session take away, that you can lend your influence and support to the power of collective action, collective bargaining, and building a just and equitable future for all of us together. Thank you.